On August 14, 2024, the World Health Organization officially declared Mpox, formerly known as monkeypox, a public health emergency of international concern following the identification of a new highly transmissible strain, clade 1, which can cause more severe illness. The emergence and rapid spread of a new strain, clade 1b, in the Democratic Republic of the Congo, which reports 90% of the cases, and the neighboring countries of Rwanda, Uganda, Kenya, and Burundi are the most affected by the reported Mpox cases. This declaration underscores the urgent need for global attention and coordinated action to combat the spread of the virus. The Ministry of Health, Wellness and Elderly Affairs took a proactive approach to put the necessary coordinated systems in place to facilitate strengthened surveillance, early detection and management of possible cases. Strengthened surveillance at every level is important to rapidly identify any cases coming into the country from all levels. This includes at the ports of entry, into hotel accommodations, schools, workplaces and communities. This will allow early identification of cases and clusters to provide optimal clinical care, the isolation of cases to reduce further transmission, contact tracing, and the identification and protection of high-risk groups. Mpox health sector preparation has commenced with the sensitization of healthcare workers from the public and private sector, which was done on Wednesday, August 21, 2024. This training continues at the level of the various health facilities. The medication stock at central procurement has been reviewed and the necessary procurement is underway. All health institutions are working on ensuring conditions are in place to manage possible cases. St. Lucia has the capacity for Mpox testing by the detection of viral DNA by polymerase chain reaction. Clinicians have been updated on the testing protocol and the present testing capacity is being increased at this time. This week, the public health officials will be sensitizing key stakeholders on the necessary protocols. These include the St. Lucia ANC Ports Authority, tourism sector, and the education sector. Protocols have been developed for those sectors and workplaces. There are 2 Mpox vaccines that have been approved by the WHO listed national regulatory authorities. Mass vaccination is not recommended at this time. Vaccination is indicated for close contacts of cases and travelers to the affected areas of Africa. Public health authorities are working with the regional agencies to acquire vaccines in country. Currently, there are no Mpox vaccines in country or the region. The Health Education and Communication units have completed the Mpox communication plan. This risk communication plan serves to promote the dissemination of information, public health messages to the general public to educate the target populations on prevention measures and improve early recognition, reporting, and prompt treatment of cases. It also serves to prevent the spread of rumors and false or incorrect and misinformation about Mpox. The nature of Mpox can lead to stigma and discrimination to those affected and their family. The team is also working to reduce the potential of this in country. As we continue to strengthen the Mpox response plan, the Ministry of Health advises the public to remain vigilant and adhere to the following guidelines to reduce the risk of infection. Limit contact with individuals showing symptoms of monkeypox, which include painful, unusual rash or lesions, fever, headaches, muscle ache, backache, chills, and swollen lymph nodes. These symptoms can last for 2 to 4 weeks. Wash your hands frequently with soap and water and use hand sanitizer if soap is unavailable. If you experience symptoms or have been in contact with someone who has Mpox, visit your nearest health center or emergency room for management and Mpox diagnostic testing, which is available in country. Avoid contact with the contaminated materials used by sick persons. Follow updates from the Ministry of Health, Wellness and Elderly Affairs for the latest information and health alerts. The Ministry of Health, Wellness and Elderly Affairs will continue to monitor the situation closely and provide regular updates as more information becomes available.